Hello, my name is Dr. Angela Rabbit. I'm a child abuse pediatrician with Child Advocacy and Protection Services at the Medical College of Wisconsin, and I'm also the program director for the Child Abuse Pediatrics Fellowship Program with the Medical College of Wisconsin and affiliated hospitals. As you all know, fellowship recruitment and interviewing are going virtual this year, so we wanted to put this video together to give you an opportunity to get to know our program a little bit better. I asked a couple of our faculty members to give us their perspectives on the fellowship program, what is unique about this program, and what they enjoy about being a part of our section, Child Advocacy Protection Services. Several themes emerged: the wide variety of experiences our fellows get, the education and the mentoring within our program, and also the work-life balance. The CAPS Fellowship is a 3-year fellowship program where fellows will develop an expertise in the medical evaluation when there are concerns for child maltreatment, as well as identifying medical conditions that might mimic abusive injuries, skills in documentation and expert witness testimony, and in advocating for the prevention and improving the system's response to child maltreatment. One of the benefits to our program is the diversity of patients that you'll see here. We're one of the largest programs in the country. We see over 7,000 patients per year between our inpatient consult service and our multiple child advocacy centers. Our primary outpatient teaching site is the Milwaukee Child Advocacy Center, which is housed within Milwaukee's Family Peace Center. Multiple investigative and community agencies are co-located in that building, which makes it an excellent systems-based learning experience for our fellows. But fellows also rotate through multiple other child advocacy centers in both urban and rural areas throughout southeastern Wisconsin. There are differences between urban and rural settings in terms of practice, but our fellows leave with experience in both. Fellows are also very active on the inpatient consult service. Children's Wisconsin, located in a suburb of Milwaukee, is our primary teaching site. Children's has a large catchment area that includes most of Wisconsin and parts of Illinois and Michigan.
We work well with specialists from many subspecialties, including ophthalmology, neurosurgery, radiology or imaging. We have 2 professional photographers on site. We perform both inpatient hospital-based consults in the emergency department, hospital-based clinics, and in the hospital wards, including an active pediatric intensive care unit. But we also have excellent relationships with people throughout the hospital and at the medical college. Through these relationships, through excellent clinical care, through regular peer review and a focus on quality improvement as part of our culture, we are at the leading edge nationally of best practice.
The CAPS Fellowship curriculum includes at least 12 months of time devoted to scholarly activity, maybe more with electives if it's needed. We have statistical and research support here, as well as ample opportunity to learn and practice quality improvement methodology. The rest of the fellowship is clinical, including structured experiences with other subspecialties that we frequently work with in child abuse pediatrics, such as radiology and experiences with mental health providers. We also have an excellent board review didactic program. We spend 2 years working through a board review curriculum, which is based on the American Board of Pediatrics content specifications for the Child Abuse Pediatrics Board's exam. These sessions include one-on-one didactic training with our attendings, so when fellows leave the program, they know they've reviewed the entire board content specifications and that they're prepared to do well on their board exams. But the curriculum is really very dynamic. It's based on the needs of the fellow. So if you have a particular interest or an area where you would like more instruction, we can tailor the fellowship to the fellow's needs. And we only take one fellow every 3 years. So our focus is on preparing you to practice confidently once you leave our fellowship program.
The mentorship within the Department of Pediatrics and specifically within our program is amazing. All of our attendings are at the ready and available to our fellows. We do not depend on our fellows for work, which is quite different from many other fellowship programs. Our fellows do work, but we don't depend on them for that. In other words, their focus is really education.
Personally, I feel one of the most important benefits to this program is the people and the support that we have here. Child abuse pediatrics can be an emotionally taxing field, but in this program you'll learn how to manage burnout, how to build resilience, and how to maintain work-life balance as a child abuse pediatrician. That's why in this program we have providers that have been here for 10, 20, even 40 years. Turnover is very low, and that really is a reflection of the culture and the support that this program has.
There are a number of things that are unique about this program. I could tell you about the board review, the comprehensive board review that we have access to. I could tell you about the multidisciplinary team, the nurse practitioners, the sexual assault nurse examiners, the social workers and advocates that we work alongside. But really what stands out to me is the emphasis on work-life balance. Whether it's arts and culture, whether it's sports or music, whether it is festivals, beer gardens, everything that you could want is here. This is also a really great place to raise a family. There are great schools in the area. I love my work. It is so much more than a job, but I also have a life outside of work. And I can have a family and I can have fun, and both are important, both contribute to my resiliency, and both are reasons that I stay here.